Microphone.
We will begin with a moment of silent reflection for our first responders. That'll be followed by the invocation by Pastor Alice Pappas of Oceans Unite Christian Center. And that will be followed by the Pledge of Allegiance led by Dylan Reingold, the County Attorney. If you'll please rise.
And so, Father, we come before you this morning in the name of your precious Son, Jesus. And Father, as we have taken a moment of silence for our first responders, we want to start this morning by praying for them. We ask, Lord, that you would protect them on the roads, that you would protect them in their jobs, protect their families, and strengthen their families. Father, we ask that you would cover and hide them from the enemy in this region, that your hand would be mighty upon them, and your angels would surround them. Father, your word declares that when your disciples asked, how should we pray? You said to them that we should pray like this: Our Father, which art in heaven, hallowed be thy name. And then, Father, you said that we should say, your kingdom come, your will be done on earth as it is in heaven. So we ask that your kingdom would come and your will would be done in Indian River County. Father, that your will be done. Lord, you also instructed us that we should pray for those in positions of authority. And so as we as a church constantly do, even this morning, we lift up these men and women that have been placed in positions of authority. We ask that you would strengthen and encourage them. We ask that you would bless them, that you would speak to them, that you would give them favor, that you would give them wisdom, Father. We ask, Lord, that in this area your will be done. We give you all the glory and the praise for the prosperity and the things that you've already done in this region, and ask that you would continue to do it. Bless Indian River County, Father. Bless this region. Protect our schools. Protect our business institutions. Protect our government institutions in this region. At the end of it all, we ask that you would have your way in all things. And we will always give you all the glory, all the honor, and all the praise. In Jesus' precious name. Amen. Amen. Thank you.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much, Pastor Pappas, for the prayer. We, just as a reminder to people, if you're going to speak today, or after you speak, if you would, go to the back of the room in the vestibule. There are public speaking cards. If you could fill those out and leave them behind, they will help the clerk make a better set of minutes. So we'd appreciate the assistance with that. Moving on to item 4 of the agenda, additions and deletions to the agenda. Any additions or deletions? There being none, we have a motion to approve from Commissioner Flesher, second by Commissioner Zork. All in favor? Aye. Passes 5-0. We move on to proclamations and presentations. There's the presentation of a proclamation honoring Sasan Rouhani on his retirement today. And is Sasan around?
Oh, he is. Front row.
Sasan, come on.
Sasan, you got some folks to stand up with you. Come on, everybody come on up.
Don't be shy.
Just a few.
Well, Sasan, thank you very much for coming this morning. And it is my great pleasure to read this proclamation honoring Sasan Rouhani on his retirement from the Indian River County Board of County Commissioners, Department of Community Development, Planning Division. Whereas Sasan Rouhani retires from the Indian River County Department of Community Development, Planning Division effective June 7th, 2019. And whereas Sasan began his career with Indian River County on February 3rd, 1989 as Chief of Long Range Planning. And whereas during that time, Sasan was responsible for the development and implementation of the county's first 2-volume comprehensive plan. And Sasan, I'm still not sure I'm happy about that one. And 2 updates to that plan, creation and implementation of neighborhood plans, processing nearly 300 rezoning applications and approximately 150 comprehensive plan amendments. And whereas Sasan was responsible for working with community leaders to establish and then to manage the county's State Housing Initiative Partnership, SHIP program, and other special housing programs, dispersing nearly $50 million in funds and assisting nearly 1,900 very low, and moderate income households. And whereas Sasan was responsible for implementation of the county's impact fee program, management of concurrency, acquisition of and disbursement of over $9 million in grant funds for infrastructure projects, undertaking special projects and assignments for the benefit of the county and its residents, and whereas the state has used some of the products that Sasan produced or helped to produce as models for other communities, completing his work often with little fanfare but with lasting impacts. And whereas Sasan has gained the respect and admiration of his colleagues, co-workers, community leaders, organizations, and agencies within the county and throughout the state. Now therefore be it proclaimed by the Board of County Commissioners of Indian River County, Florida, that the board applauds Sasan Rohani's efforts on behalf of the county, and the board wishes to express their appreciation for the dedicated service he has given to Indian River County for the last 30 years. And be it further proclaimed that the Board of County Commissioners and staff extends heartfelt wishes for success in his future endeavors. Adopted this 4th day of June 2019. And Sasan, on behalf of Board of County Commissioners and all the people of Indian River County, would like to thank you for your 30 years of service and be happy to hear a few words from you today.
Good morning.
Morning.
Thank you very much for this proclamation. I really appreciate it. I really don't know where the 30 years go by. It seems so, but I remember when I came for interview, actually Bob Keating was doing the interview, and he told me that we just finished up the comprehensive plan for Palm Beach County when I applied for here, and Bob told me that our comprehensive plan is due in 6 months, and based on our own schedule, we are behind in 2.5 years. But in that 6 months, everybody, of course, you have the best employee in the world. Everybody in every department, they help, and we really spend lots of time. We even stayed here overnight, and we did the comp plan in 6 months. And it happened to be too volume, but it was one of the best plans based on what State and Regional Planning Council, they told us. There are a few things that I'm really proud of it through all of these years. One of them is all the assistance that through the SHIP program and the similar program we gave to the people that otherwise could not help them. There are many young people that they want to buy their first home, but they don't have enough money to save for down payment closing costs. But they could pay the money that they pay for the rent for the mortgage payment. We help them with down payment closing costs. There are many people that they own their home, but they are in Social Security, they cannot maintain it, they need some rehab. And I'm really glad that we help those folks. The other thing that I'm really proud is all the work we did with the different neighborhoods and all the trust that we built with the different neighborhoods, and really that was great. And the last thing that maybe Jason should be really proud of it is overall we brought over $60 million worth of the grant to the county. And if you consider that each one of them is 10% administration, it means that me and all of my section, we didn't use the taxpayer money. We brought the money in for the, for the admin to pay for all the salaries. But again, I'm so glad, that we always have the support of the commissioner and, the county administrator, attorney's office, and all other departments. And I especially thank, Stan that been here, from day one that I came, and he gave all the support that, we need to do the job. Thank you so much. And I hope, everybody asks me what you want to do, and that is a $1 million question that my wife wants to know, but I don't know yet. therefore, I don't know. There are friends and neighbors, they are trying to help me with some stuff that they want me to do, But again, I don't know yet still what I'm going to do. First, I'm going to relax for a little bit and do some traveling and then see what happens. Thank you again. I appreciate it.
Son, come on up. You want to bring your family up for a picture or anything?
And the whole rest of that crowd. Suzanne, thank you so much. Thank you.
Thank you for everything. Come up with a good list of honeydews for me. Okay?
We gave her one.
Oh, yeah, okay, good, good.
Hey. There you go. We're going to be doing this again soon. Did you watch the...
Son, congratulations.
As the sun files up, before he gets too far, for those of you who have been trying to secure difficult approvals on something, Sasan will be planner of the day, and we talked about he's got this big happy stamp marked approved, so you might want to make a reservation for Thursday because I think it's going to be a little crowded.
Mr. Chairman?
Yes, sir.
I just want to say to Suzanne, thank you so much for what you've done for all of us and for all of the citizens. CC, about some 15 years ago, when I chose to leave the law enforcement arena, and I wanted to enter into this safe political arena, Suzanne, you were the first individual that I came to the county and spoke with. And you mentioned a few programs, and you mentioned a program SHIP, and I said, what's a SHIP? And you explained it so well that I served on the SHIP review board for 6 years with many of the individuals that have accompanied you today. And I also learned a lot about the true character of what a Suzanne is. And I want you to know, I want to thank you for your wisdom, your insight, and your caring concern for those who are in need and need to go forward, and you finding a way through the system to ensure that they get there. So I just want to say thank you, Suzanne. It's been a privilege and an honor to work with you professionally, and we hope that you don't go too far. And we have given Parisa a minor list for you to have to work with. When that's done, please feel free to come back and hang out with us. Thank you.
Mr. Chair,
Yes.
if I could add one other thing. First of all, Sasan, thank you for helping with all those grant dollars and the administrative money. So that made me very happy. But I do want to share just a little story. If you don't know Sasan's story, his origin story, it's an exemplification of the American dream. He came to this country. He was persecuted in his birth country, and he came here, and that's kind of what the American dream is about. And he did many things here, but one of those, as we know, is the SHIP program and helping other Indian River County residents fulfill the American dream to own their own home or to be able to afford their own home. And I think it's just a great story, and I want to thank him for his work in paying it forward and continuing that chain of the American dream, if you will, and made a significant contribution to our community in his 30 years. So thank you, Sasan.
Let's give him one more.
We'll now move on to information items. There are two I'd like to mention if I could. One is a proclamation that won't be read today, but it honors Stephen Shrow of the Department of Emergency Services Fire Rescue, with 30 years of service. So thank you very much, Mr. Schrow. And the second one is honoring David H. Bishop for his retirement from Indian River County, also from the Department of Emergency Services Fire Rescue, and also with 30 years of service. So thank you very much, Mr. Bishop. I hope you both enjoy your retirements. Anybody else care to pull anything from item number 7, information items? If not, we'll move on to the consent agenda. I'll ask if any commissioner wishes to pull something from the consent agenda.
Mr. Chairman, I'd like to pull item 8E, please.
We have 8E by Commissioner O'Brien. Anybody else? Is there anybody from the audience who'd like to pull anything from the consent agenda for discussion? If not,
Mr. Chairman, move approval as amended.
Second?
we've got a motion from Commissioner Flesher, second by Commissioner Zork, to approve the consent agenda as amended. We move on now to item E. Oh, the vote. You guys
Yeah,
want to vote
okay.
for this? All in favor?
Aye.
Aye. Any opposed? Passes 5-0. Commissioner O'Brien, item E.
Thank you, Mr. Chairman. This is the quarterly tourist development tax report, and just, Jeff, you know, looking at the little spreadsheet there, you'd think that the numbers were looking good, but when you read the footnotes, it's actually kind of skewed, mainly because you and your staff have done a good job of going back and getting some laggards to pay the tourist tax, and so we've got some prior quarter collections, but overall, you know, when you take all that out, it's down about 1.7%. I think that's what we're seeing in the monthly reports, and it says that some of the hotels, their revenues are down. It seemed to me the town was full during the season, so I don't know, is it the hotels charging less, you think, on their room rates, or are we missing collections?
We believe it's still some non-compliance out there, and that's what we're actively going after right now. My auditor is going to be going to Orlando to do some audit for a central office that has hotel here. So we believe that a lot of it pertains to non-compliance, and we're on it.
Okay, yeah, because it sure seems like the town was full, you know?
Yeah,
Kinda-
it was. Yeah.
Okay, very good. Thank you, Jeff. Mr. Chairman, go ahead and move approval of item 8E. Second.
We have a motion from Commissioner O'Brien to approve, second by Commissioner Flesher. Any other discussion? Anybody from the audience care to comment on this issue? With not, all in favor? Aye. Any opposed? Passes 5-0. Move on to constitutional officers and government agencies. We have Indian River County Sheriff Darrell Law, a request that $72,725 from the Law Enforcement Trust Fund be used to purchase equipment and support programs.
Move approval.
We have a motion by Commissioner Flesher,
Second.
Second?
second by Commissioner O'Brien. Any discussion by anybody in the audience? Sheriff, care to say one quick word?
Yes, sir. Thank you, and good morning, Commissioners. And just for the record, those dollars cannot be used for salaries or benefits of employees. Thank you.
Thank you very much. All in favor?
Aye.
Any opposed? Passes 5-0. Moving to public items. The first is a public hearing. This is continued from April 16th, 2019 Board of County Commission meeting, consideration of the disposition of county-owned surplus properties for affordable housing administrative action. Mr. Bowling.
Thank you, Mr. Chairman. For the record, Stan Bowling, Community Development Director. So this is a continuation of a public hearing that began on April 16th. It has to do with the process we go through every 3 years under state statute to look at properties that the county has and determine what properties may not have public use at this point in time, and what properties may be appropriate for affordable housing efforts. And there is a resolution that does need to be acted upon by the board with an adoption deadline for us July 1st, 2019. And it's the same process that we've gone through. We really rely heavily on all the different county departments, and including the GIS staff, which have helped tremendously in going through the process of looking at the 523 properties owned by the county. Came up with a list of 8 that are not specifically designated for public use and that could be useful for affordable housing efforts. Some of the lots, they're all single-family lots, could be buildable on their own, and some, even though they might not be separately buildable, could have value, especially to adjacent property owners. So they have value that could be harnessed for affordable housing efforts. And you all saw the list back in April of 8 properties. We've included an updated chart here with our recommendations on specific properties. There are a number of options that the board has. The basic options are to sell the properties and put the proceeds into the SHIP trust fund, sell the properties to the highest bidder with a deed restriction, to develop it as affordable, or to donate properties to nonprofits with a requirement that they be used to develop affordable housing. And there's also just the ability to use a combination of those options. In the past, the county's used both options 1 and 3, and in fact, that's what staff is recommending for the continued public hearing. So at the April hearing, it was opened, and you all considered staff's recommendation to get input, but to continue the hearing to give staff time for nonprofits to evaluate and formally request donation of properties. You all heard input and continued the hearing to this morning. After the April meeting, staff prepared a form and really just sort of a process for any nonprofit to give us information on which specific lots they might be interested in, how that might fit in with their program and their ability to perform, essentially. Those forms were sent out to the 4 local affordable housing nonprofits: Habitat for Humanity, Every Dream Has a Price, Treasure Coast Homeless Services Council, and the Housing League, Inc. The only nonprofit housing organization to submit a request was Every Dream Has a Price, and they've requested 3 specific lots to be donated to them to build affordable housing rental units for extremely low, very low, and low-income households. And that those 3 lots were the ones that were also shown to you all at your April meeting. So it's the same ones that they've been interested in since just before the April 16th meeting. In the event that you all agree to that donation, staff went ahead and proposed an agreement, worked up an agreement that's in your backup. Every Dream Has a Price, and the county attorney's office have looked at the agreement, and it's acceptable. Under the agreement, Every Dream Has a Price would have to build affordable housing units on the donated lots within 3 years. The units would be deed restricted to remain affordable in perpetuity, and they would have 3 years to build the homes unless the Board of County Commissioners extended that 3-year time frame. So the disposition of the lots, staff is supportive of Ed Happ getting the donation. They've demonstrated in the past that they can build on donated lots, and they're agreeable to all the restrictions, and it's the best way to get affordable housing is actually get units up out there. Staff also supports selling the remaining 5 lots with the proceeds to be deposited in the SHIP trust fund, and so staff's recommendation at the conclusion of the public hearing this morning is that the board do 3 things. First, approve the attached list of the 8 properties being surplused for affordable housing purposes. Second, that you agree to donate the 3 lots requested by Every Dream Has a Price, and authorize the chairman to execute the agreement and the attorney's office to work on the deed and the restrictions for the transfer. And thirdly, to direct purchasing division to sell the 5 remaining surplus properties, and with the proceeds going into the SHIP trust fund. I'd be glad to answer any questions that you all might have.
Thank you very much, Stan. Any questions for Stan? Commissioner O'Brien.
Stan, on the 3-year time limit, it said that 3 years from the date of the transfer of the lot.
Correct.
Are we going to transfer all 3 of these at the same time, or are we going to stagger it out a little bit?
I would assume it would be at the same time. That's kind of one of the workings with the attorney's office, but I assume it would all be at the same time.
Okay, so Jillian, are you okay with that? Okay, all right, great, thank you.
Mr. Chairman, I have one question. Under impact fees, most of those had water and sewer when that was installed in the Gifford community area. So would those be additional ERU credits, but not necessarily impact fees?
Correct. So they, I guess technically we call those connection charges or capacity charges, right? So there would be impact fees for other facilities, but in terms of ERUs, if, however utilities would normally, account for those would be accounted like anywhere else.
All right, great, thank you.
Any other questions for Stan? If not, I will now open the public hearing. I'll ask if there's anybody from the public who would wish to speak on this item. Good morning. Name and address to the record, please.
Good morning. Jens Tripson, 2525 14th Street, Vero Beach. I'm here representing Every Dream Has a Price. And I would like to thank you all for donating this surplus property. Our board of directors thanks you, and the people that we're going to be able to help in the community that are in need especially thank you. And it takes all of us to do it. You know, it takes you guys, it takes staff, it takes people like Julianne and I'm drawing a blank at the moment.
Louise?
Yes, Louise, I'm sorry. But it really does, and we have donors, and you know, we're going to really hit the donors hard to hopefully meet the 3-year deadline, and if not, we'll go on the next 3 years if you all allow us to do that. But I believe we'll be able to get it done with the response we've had in the past. Thank you very much.
Thank
Thank
you.
you. Anyone else from the public wish to speak on this item? If there is no one else, I will now close the public hearing. Before deliberating, I'd just like to take a moment to just thank Every Dream Has a Price and Julianne Price and her board. I'll note that they've built a number of these homes in the past. They've done a great job, and they help people who really need them. This is a tremendous service. I believe that in something like we may be doing today, the donation of 3 lots, Indian River County residents gets tremendous value from the activities of Every Dream Has a Price and the people who work for that group. So I just want to take this opportunity to thank you very much for all you and your board have done with this. And with that, I'll ask if there's any,
Chairman, I'll make a motion to approve staff recommendations to declare the 8-lot surplus, to donate the 3 lots requested to Every Dream Has a Price with the deed restrictions and conditions, and then direct purchasing to sell the remaining 5 lots.
Second.
we've got the motion from Commissioner O'Brien, second by Commissioner Fletcher. Any other discussion? All in favor?
Aye.
Any opposed? Passes 5-0. Thank you very much. And Stan, thank you. We now move on to public discussion items. There's one, a request to speak from Peyton Fecca and Andrew Casera of Vero Beach High School students regarding TNR Community Cats of Indian River County. Are the gentlemen here? And lady, come on up to the dais, please. And if you would, just before you speak, give your name and address for the record, please. It looks like it's going to take you another minute, take your time, but we're going to go ahead and let the county attorney read a couple items while you're preparing that. So we'll move on to the public notice items just for a minute, and I turn it over to Mr. Reingold.
Thank you very much. We have 2 public hearings scheduled for June 11th, 2019. The first is a consideration of a county-initiated land development regulation amendment to Chapter 926 regarding changes to palm credits for canopy trees. This will be legislative in nature. The second public hearing that will be held on June 11th will be the consideration of a request by Gary Middleton to amend land development regulation Chapter 971, regulations for specific land uses, by changing the maximum building height for self-service storage facilities in the CG General Commercial Zoning District. This will also be legislative in nature. Again, those are 2 public hearings scheduled for June 11th, 2019. And with that, I turn it back over to the chair.
Thank you very much, and we'll go back to the public discussion items. Ms. Fecca and Mr. Casera, you ready to go?
I think they're still waiting for a hookup.
Okay, so then I think the next item would be short, so we'll go to Human Resources approval of time and attendance software, Cronus Workforce Ready, and workforce accruals. Good morning.
Suzanne Boyle, Human Resources Director, Indian River County, Board of County Commissioners. Really excited to bring this to you today, and I know my department heads are excited as well. It's a time and attendance software package so that we can accomplish the payroll for our employees in a more efficient and effective manner.
Any questions?
Move staff recommendation.
Second.
We've got a motion from Commissioner O'Brien, second by Commissioner Fleischer. Any other discussion?
Mr. Chairman,
Yes.
just one item to ask and to clarify, that on the electronic check-in version, so that the public knows this, the employee would have to be in a geo-fenced area around the facility where they would normally check in for work? Is that how that?
Right, we could have time clocks. You can clock in through your computer when you report to work, or a web-based application with a geo fence around that work location that would allow the member, when they're within the fence, to clock into work.
Right, so they couldn't clock in from a remote location saying they're at work. They'd have to be in the presence of that facility.
Absolutely, yes.
Thank you. That's all I have, Mr. Chairman.
Thank you. Is there anybody from the public who would like to ask anything about this item? If not, we've got the motion by Commissioner O'Brien, second by Commissioner Fleischer. All in favor?
Aye.
Aye, passes 5-0. And with the board's allowance, I think the medical and pharmacy benefit issue may take a little bit, and I don't want to keep the other people waiting too long between items. So while we're waiting for their tech, we'll go to Public Works, because I don't think the first item there will be too long. So, Mr. Spierka, if you would, the purchase order for mast arms in Indian River Boulevard and Grant Harbor Boulevard mast arm.
Rich Barrica, Public Works Director. Back in May, the board approved a work order with Kimley Horn to design a signalized intersection at Grand Harbor and Indian River Boulevard. Staff reached out to the mast arm production companies, as mast arms take anywhere from 20 to 36 weeks to get into production and delivered to a project. Because of that, staff reached out to the 4 companies that build mast arms in the state, and we received quotes from 2 of the 4 companies. One quote was for $98,540 with a lead time of 36 to 38 weeks. The second quote was from DOT Lighting, which was $100,668, which is about $2,000 more, but the delivery time was 19 to 20 weeks. Project is scheduled for construction in November of this year. So we would like to move forward with the purchase of the mast arms. Funding is available in the CIE, is available from gas tax. Staff recommends the board waive the requirement for bids and authorize the purchasing division to issue a purchase order in the amount of $100,668 to DOT Lighting for the purchase of the mast arms with approximate delivery time of 19 to 20 weeks.
Any questions from Mr. Spierka?
So this requested action moves the project in direct alignment and would be better serving the citizens.
It'll better serve the citizens. Not only will we get a tax break on it, it'll decrease the time when the project looks like a bomb went off in the intersection as we're waiting for the mast arms to be delivered. It allows us to move forward quicker and more efficiently.
And it's a $2,000 increase.
Yes, sir.
Move approval. Any other questions for Mr. Spierka?
Yes. One, Mr. Chairman.
Go ahead. Well, yeah, okay, we have the motion from Commissioner Fleischer, second by Commissioner Adams. Commissioner Zork.
Yes. Can we implement this same strategy for the 37th Street improvements when that, so we don't have that lag time that you're talking about?
Yes, we're doing it on all of our projects that
Okay.
require mast arms to make it more efficient, and we get in and out quicker.
Right. Okay. Thank you, Mr. Chairman.
Any other questions for Mr. Spierka? Anybody from the public wish to comment or ask any questions? There being none, all in favor?
Aye.
Any opposed? Passes 5-0. Are you all ready yet? Okay, great. We're going to move back then to public discussion items. Request to speak from Peyton Fecka and Andrew Casera. Good morning. And if you would, name and address for the record, please.
I'm Peyton Fecka.
Andrew Casera, 950 48th Avenue.
2075 South Porpoise Point. We're from Vero Beach High School.
Good morning.
Good morning. Thank you. Okay. We're here to focus on introducing the practice of TNVR to Indian River County. We have been using euthanizing cats as a way to decrease population size, and we have seen over time that this isn't working, and we believe that we should make the switch over to TNVR, which is trap, neuter, vaccinate, and return. So what this would do is when a feral cat would come in, instead of euthanizing the cat, you would instead spay or neuter it, give it its vaccines, and then return it back to where you found it. The thing that is keeping us back from this is the cat leash law, which is saying that if there's a cat outside, any cat, that it needs to be on a leash. So when organizations are trying to implement TNVR, they aren't able to because they're getting fined for releasing these cats back into the wild. Earlier this year, we went to a convention in Orlando held by the Best Friends organization. They are animal activists that push for TNVR and show how we can implement it. This was one research project that they showed us in Tucson, Arizona at the Pima Animal Care Center. They tried to make the switch to use TNVR instead of euthanizing cats. And after the first 2 years, they decreased their rates of euthanizing the cats by 90%. And because of this, you can see that the feline intake decreased by 26%, and the intake of kittens under the age of 6 months also decreased, and that decreased by 40%. So you can see that the population of kittens is continuing to get smaller, so the cat population will become smaller. So as you can see, euthanizing the cats wasn't working in decreasing the population size, but this did. So we believe we should try to make the switch to this.
So all right, as you
Name
can
and
tell.
address for the record, please. You did? Okay, so, good.
Adam Cohen.
Okay, so another supporting evidence or study that helps support TNVR was a national survey in 2014. As you can tell, 68.3% were in support of TNVR, 23.9% were for lethal injection, also known as euthanasia. You're basically killing the cat. And then 7.7 didn't want to do nothing. As you can tell, approximately like 70% were willing to do TNVR and were willing to like save the cat because the cat also sadly, they don't have a voice, and we would love to speak for them.
Okay, so we did a study over this year through the biotech program at our high school, at Vero Beach High School, and we did this because one of the main arguments against TNVR is that people assume that these feral cats are diseased and that they're going to transmit these diseases to people's domestic cats and that this will cause issues. So we did this research to see if this was a real issue. So we did the two really big transmitted diseases in cats is feline immunodeficiency virus and feline leukemia virus. These are both viruses that impact the immune system of the cat. But FIV, the cat can be infected with it and it will stay dormant in them. And so you may not see symptoms of it for years, so the cats can live a normal life. FELV, 70% of cats can actually fight off this disease when presented with it. So it's honestly not as big. Like if you have a healthy cat, you probably won't get this disease. But one of the main way that these two diseases are transmitted is through saliva of an infected cat, and this is with commonly with bite wounds. So actually, when you use TNVR, these cats are no longer looking for mates, so the males aren't fighting each other, and which will drastically decrease the transmission of these diseases. So it honestly, using this practice will pretty much take away the spread of these diseases.
Okay, so we partnered with Dr. Dance on this with our research project. So every feral cat from Indian River County we tested. So 117 cats we did. So four out of them, 3.4% tested positive only for FIV, and then only 1.9% tested positive for both FIV and FELV, and the rest, 95.7%, tested negative for both diseases. So as you can tell, the red dots tested negative for both diseases, blue dots tested positive for just FIV, and then the green dot tested positive for both FIV and FELV. As you can tell, it's centered around Vero Beach and Florida Ridge, so along the East Coast. And where the cats that were infected of these diseases, the cats surrounding them didn't get infected at all. So it's sort of showing how the disease doesn't spread as most people think. And this is up in Sebastian Fellsmere, which also shows how not many cats up there, or not at all, are infected with FIV or FELV. Thank you for your time.
Thank you.
Thank you very much.
Mr. Chairman, just one comment for the students. Thank you for coming.
Yes.
You know, the one lesson I learned years ago in public speaking is you always want to make sure you coordinate your technology prior to your time to speak so that you're ready to go. But thank you for your presentation. It's very well done, and I appreciate the passion you have for this, and so thank you for coming this morning.
Thank you.
Thank you
Mr.
very
Chairman,
much.
also like to add, presentation very well done, very nicely put together, and your speaking points cover the topic very well, and just very professionally delivered.
Thanks. Move on now to back to Human Resources, Medical and Pharmacy Benefit Recommendation for Plan Year 2019-2020. Hello again.
Good morning. Suzanne Boyle, Human Resources Director, Indian River County Board of County Commissioners. And the agenda item that you have before you is one that we bring every year, where we're looking for the next plan year and what we may need to do related to our benefits. Under the county's plan, we insure 3,600 lives. Out of that, we have about 340 retirees, and we have their dependents, spouses, children, grandchildren are insured under this plan. As we look at our financials and our plan experience, we work with our benefits consultant and the actuary to assess where we're going to be next year. And our funding this year is a little bit over $18 million, and it's looking like next year we're going to hit that mark. We're going to be well over $20 million to provide medical and pharmacy benefits to the 3,600 lives that are under this plan. Interestingly, insurance is there for that time that we need it, right? So we had 48 members of our plan who had major events that cost over $5 million to the plan. So think about 48 members out of 3,600 lives, over $5 million just for those folks, and we continue to provide other benefits under the plan. So as we were reviewing the financials, it became clear we're going to have to increase funding over the next year. And that increased funding comes from employer contributions and employee contributions and retiree contributions. In looking at that, currently we have a single plan. That plan is considered a gold plan. It's a very high level benefit, providing an actuarial value of about 88%. It's a great plan. Today, that plan costs $50 a month for a single coverage, and full family coverage is $267.50. So it's a pretty great deal. However, when we look to increasing the funding to provide the benefits as we move into the next plan year,
Excuse me, there's a little too much chatter here. It's a little hard for us to actually pay attention to the person who's speaking. So if you do want to have a conversation, if you could please take it outside, appreciate it. Sorry for that.
oh, no problem. So as we look at providing funding for the next plan year, we're faced with a cost issue that impacts the county, a cost issue that impacts the covered members. So we knew this point in time would come where we might need to introduce a second plan that doesn't provide quite as high a level as the gold plan, still provides an excellent benefit, but is a little more affordable for employees on a monthly basis out of their take-home pay. And that's the introduction of a silver plan. We call it a premier silver plan because it provides an actuarial value of 80%. Now what that means when I say actuarial value, it means that over the course of a year, the plan is expected to pay the claims costs associated with medical and pharmacy benefits to the level of 80%. And then the members would pay out-of-pocket expenses averaging up to about 20% of total costs. The Premier Gold plan, which is our current plan today with a couple of tweaks, that provides an actuarial value of 88%, meaning the plan would be reimbursing 88% of medical and pharmacy costs, paying the lion's share, and then member coinsurance would account for about 12%. So we're introducing this second plan as a way for employees to have a choice, retirees to have a choice on what level of insurance do I need for my family, for myself. Do I need the Premier Gold and the increased premiums associated with that, which we're proposing at $110 a month for single coverage, $400 a month for family coverage. And I included a chart in there that illustrates how our premium, our proposed premium of $110 and $400 a month would compare to area employers. Now, as you look across that chart, you're going to see that the costs range substantially. Some people are paying close to $900 a month for family coverage for a plan similar to our gold plan. So when you look at that $400 a month premium, while it's an increase from our $267.50 that we're paying today, it's substantially less than what a lot of employers and their members are paying for their family coverage. So gold coverage, Premier Gold coverage, high level plan value, $400 a month for family coverage, $110 a month for single coverage. But some people don't need the gold coverage. Some people don't want to pay $110 a month for single coverage or $400 for family coverage. So we've introduced the Premier Silver plan at a level of $40 a month for single and $257.50 for family coverage, still providing a very sound and high-level actuarial benefit of 80%. We could have called it a gold plan, a low gold plan, but we thought Premier Silver would be the way to go. So that's our proposal before you. I've provided a breakdown of the levels of coverage. The network that's available under either plan is still provided through Florida Blue. It's the same network options, the same access to the same doctors, all of the same hospitals, urgent care facilities that people enjoy today. And the pharmacy benefit, with the exception of the co-pays, is also through the same pharmacy network. Those are the recommendations for the types of plans we offer. Then when we look at mitigating further costs and the increased costs, which we expect to be continuing to be on the rise, we're also recommending some, they call it a CAP program, Clinical Advantage Program, for our pharmacy benefit that puts in some cost controls related to medicines that are either high claims. In other words, if it's a high-cost medication, which costs the plan over $1,000 a month, there's going to be an additional level of review and prior authorization medical necessity for that before that prescription is just filled. There's also a program for a low clinical value, which means some of the medications that our members are being prescribed today are for They show low clinical value. It's a high-cost medication, but it really isn't prescribed. And correct me if I'm wrong, Jen, it's not prescribed for that reason. The FDA hasn't approved it for that reason, but it's being used for something else, and our plan is paying for it. For example, it could be a medication that, and we've all seen the ads, it's prescribed for one thing, medically necessary, but it also might have weight loss benefits, okay? So some doctors could be prescribing this to our members for weight loss, but that's not the intended purpose of it. It's actually for a different thing, and the plan is paying the cost of that. So it would cause a review to take place to make sure that the prescriptions that are being paid for out of the plan are for the intended medical purpose that the FDA has authorized it for. We've got some other programs in there, a manufacturer assistance program. It gets a little complicated, so if you want any more information about that, I've got a clinical pharmacist with Lockton Companies, Jen DeMura, here to answer any questions that you may have related to that. Another piece that I wanted to mention to you about this package here that you have before you. It's never a good thing to have to say costs are going up. Nobody likes that. But the reality is costs are going up, and the plan has to be funded in order to pay those costs for the 3,600 lives. So as we review the funding as we go into the next year to make sure that that plan is, and this is what I reinforce, that it's affordable, that it's competitive, and that it's sustainable for our members. That's where the numbers come from. Another issue that I need to mention to you, and I noticed that, Kevin, I see you here, and I see John. John and I spoke on the phone this morning. We sent notice to the union, John got it on Friday, I think it was.
Again, if you'll.
Oh, I'm sorry. Thank you. John got it on Friday, and he called me this morning, and he was concerned about how this related to the cancer presumption bill that passed. Are you familiar with the cancer presumption bill? So I assured John that this plan and the increased costs have nothing to do with the cancer presumption bill. That bill has to be paid for. The cost of that benefit has to be paid for by the employer only, okay? So that benefit that's provided by the employer through the cancer presumption for firefighters is independent of the benefit that's provided under the medical plan. So they're two separate things. This medical plan is just for the purpose of delivering regular medical and pharmacy benefits to our insured, our covered insured employees, retirees, spouses, and dependents.
Thank you. Is that it?
That is it.
Any questions? I'll start with Commissioner O'Brien.
Thank you, Mr. Chairman. A couple things. First off, I'd like to recommend to the board that we have the discussion on this item, but that we postpone a vote on it for 1 to 2 weeks. If y'all remember back when we changed our retirement plan provider and we acted quickly, then a lot of employees were impacted and wanted some input. I think it would be appropriate here that, you know, like we just heard, the fire union just got this on Friday, so they haven't really had time to get into it and think about it. I've gotten an email from other employees that have questions, and I think it'd just be really good if we just took a little time to let the word get out and make sure everybody's aware of what we're doing and get any impact or feedback. Particularly in the pharmacy benefit changes, there's about 194 current employees that may be impacted by those changes. And I would really like us to be able to have Suzanne reach out to them, let them know how it might affect them, what options they have and alternatives. I just don't want to blindside the employees and say, okay, we had this and now we're going to ram it down the throat and be done with it. So I would recommend that we take 2 weeks and vote on this on the 18th, but have our discussion now.
Was that a motion?
I'd be glad to make that as a motion, that we postpone this till the 18th meeting. And I have talked to Jason on this, and staff is agreeable on the 2 weeks.
So we have the motion from Commissioner O'Brien, second by Commissioner Fletcher, but we'll continue with the discussion.
Or you just want to vote on this motion right now, and then I have other.
No, I
want
to throw additional discussion with that, sir.
Okay. We'll go ahead.
I'd like to ask if it is all possible, if we're looking at 2 weeks, if we would consider a workshop here with all of the employees to ensure the best in communication as opposed to a newsletter and email. We've had a tremendous challenge with the email over the past 10 days, and some did not get their notifications. I may be one of them. And if that's the case, I'd rather not be reliant upon electronic transfer of information or a newsletter. And I would also like to encourage a workshop here in the chambers by Human Resources so we would have a best informed employee structure.
So that would be basically for all employees who wanted to attend the shop, not necessarily a Board of County Commissioner workshop.
That's correct. That would be,
So we'll take that as a separate item.
okay.
So we'll take the motion to table for,
To the 18th.
to the 18th.
Well, we still have time for discussion with Susan after.
We'll have,
that.
we'll have discussion after that. We'll continue it for an oral discussion and let anybody else who wants to speak from the audience speak on this issue. So any more questions on this motion? Anybody from the audience care to comment on the idea of tabling this for 2 weeks? If you want to, come on up and state your name and address, please, for the record.
My name is Mark Yano. I live on 4th Street here in Vero Beach. I apologize, this is not related to this topic.
If it's not, then please sit down for now.
When can I ask a question? Do all presentations be allowed public comment?
All presentations on the, public comment on the issue that we're talking about, yes. Thank you. Anybody else on this issue? There being none, there was the motion by Commissioner O'Brien, second by Commissioner Fleischer. All in favor? Aye. Any opposed? Passes 5-0. And now, because Commissioner Fleischer's item is so similar to Commissioner O'Brien's and dealing with communication, I'll ask you to restate your motion.
Mr. Chairman, I'd like to make a motion that we direct Human Resources Division, Susan Boyle, to have a workshop for all of our, invite all of our employees to an open forum so they truly understand what the changes are and how they are affected parties.
We have a motion by Commissioner Fleischer. I'll second it. Any other discussion?
Yeah, would you be including employees from all the constitutionals as well in that? Because they will be affected by this as well.
They are affected parties, and they are most certainly invited, as this action does affect all of the constitutional offices.
Thanks. Jason, any comments or anything before we vote?
So
Yes,
that's a tremendous scheduling effort.
Right. Staff is supportive of the 2-week tabling, and you know, our plan all along was to, anything that we do would be fully communicated with all of our employees prior to anything taking effect. But I think it's a good thing to have the discussion and have a workshop, and we will do that and include the constitutional officers' employees as well.
Great. I'll ask if there's anybody from the audience who wishes to comment on this motion. There being none, there was the motion by Commissioner Fleischer, which I seconded. All in favor?
Aye.
Any opposed? Passes 5-0.
May I continue with?
You may, sir.
Thank you, Mr. Chairman. Suzanne, so how it looks like how this is structured, set up, is that for the silver plan, might be suitable for, like, say, a single or a younger employee, or an employee and spouse only, no family, no kids, relatively healthy. They don't really need the gold coverage, and they can save some money by going with the silver. And then an employee maybe with 2 or 3 kids or, you know, whatnot, might have more higher expenses and be willing to pay a little bit more upfront on the premium, but have higher coverage levels going down the road. Is that kind of how it's?
Pretty much, and it'll be interesting because as you look at the silver plan, as I said, it's an 80% actuarial value, still providing a high level. I wouldn't be surprised if you saw families moving to that plan who didn't have a lot of needs. They go to the doctor when the head cold or something comes along, strep throat, those kinds of things, a couple of generic medications throughout the year, and they might not need that high-level gold plan either.
Good. On the pharmacy benefits, where there's going to be an analysis of some of the prescriptions and medications used, who is going to be doing that actual review? Is it going to be a doctor? Is it going to be an insurance person? Who's going to, because I get a little nervous, you know, when I mean, the the plan costs and all that front-end stuff, I get that. That's all pretty straightforward and clear. When we start looking at what medication somebody is taking and their relationship with their doctor, and now we have some third party that's going to, you know, insert themselves into that relationship medically, I get a little skitsy there, just because.
So let me tell you a little bit about the structure that we have for
Okay.
our pharmacy benefit. We have our pharmacy benefit manager, which is through Express Scripts. And then we have a pharmacy benefit administrator, which provides customer service and oversight and is kind of a, you've heard this word before, concierge customer service. So they work for us to help our members navigate the waters between the pharmacy benefit manager. So there's this extra oversight that's in place through our pharmacy benefit administrator, RX Benefits, to facilitate those types of prior authorizations and things. Jen DeMura is here with Lockton Company. She's a clinical pharmacist. She was a retail pharmacist for a number of years and then moved off in another direction. Jen can actually explain how these types of programs work and what a member could expect to experience. Jen, would you be able to come up?
Yeah, good, thank you.
Name and address to the record, please.
Sure, Jennifer DeMura with Lockton Companies. I live in North Carolina.
So my concern was, you know, who's making that decision when we review these prescriptions, and so if you could kind of walk through that for me, please.
Yeah, so typically the process would be that pharmacists would review, and just to clarify the types of things that we find with the specific to the high dollar claim review. So these would be any claims over $1,000. So typically most of your very expensive drugs have prior authorization guidelines in place anyway. So your really high cost specialty drugs, you may have heard of like Humira, for example. So that's already got a guideline in place. But then you have other claims coming through that are really expensive. And what RX Benefits does is their team of pharmacists will review each of those claims on behalf of Indian River County to make sure that they're clinically appropriate. For example, sometimes drug manufacturers will develop sort of a new formulation of a really old drug and then jack the price way up. And so what they're doing is they're saying, hey, there's still this older formulation, it's just a different dose. So they might come out with like an extended release formulation of 1,000 milligrams and charge you, 4 or 5 times the amount that you would get by taking 2 500 milligram tablets of a drug. So those are the types of things that we're looking for in those high dollar claim reviews that come up on behalf of your members. So just looking to identify any ways that we can help save. And if it's clinically appropriate, then the claim gets approved and it pays. But it's typically pharmacists that are conducting that review, and they may reach out to a physician and just discuss, opportunities and best strategies for managing that patient.
Yeah, okay, so again, that's the one area where I'm a little gray on, because I think it really is kind of getting into a very sensitive area. And I guess I just want to make sure that, and I understand, the need for the savings, and the drug companies can change it and jack the price up. I want to make sure that the employees are getting the proper health care that they need, and that we're not taking away something that they really need or depend on.
Of course, totally understand. There's just one other example I'd like to share, if that's okay. And that's more related to the low clinical value drugs. And I just want to share an example with the group of a couple of drugs called Duexis and Vimovo. These drugs came out recently. They consist of an anti-inflammatory drug like an ibuprofen with an anti-ulcer drug like a Pepcid, something that both of which you can buy over the counter at the pharmacy for $10 to $20 a month. These drugs are over $2,000 being billed to health plans and employers. And so those are the types of things that we're looking to reduce. Most of your members probably have no idea that that's the cost that they're paying for 2 drugs that they could very easily buy over the counter. So these programs are really just meant to protect the county and also protect the members from questionable practices by drug manufacturers.
So, again, so what you're saying is that you would work with those employees, say, hey, you can buy Pepcid over the counter, and you can buy ibuprofen, and you're getting the exact same thing that this $2,000 drug is, and they should be getting the same level of relief and
Absolutely.
and all that. Okay.
Yep, and that would be perfect for the workshop.
And in that scenario, so the employee would be paying a $50 copay probably, likely for that drug, and the plan is paying several hundreds or $1,000 for that medication. That is clearly two over-the-counter medications stirred together, okay? So we've got bad actors out there in this business. So this program is trying to get around that situation where you have companies that are clearly doing something just for their profit. There's clearly no benefit to the patient for charging this extra money. And when we say, why are healthcare costs going up, this is some of why it is. And so we're just trying to manage that and make sure that we're not paying a significant amount of money that honestly jeopardizes coverage for other employees. Or it raises the cost and increases these premiums, these things that we're looking at. So we're trying to maximize the health plan, not to the detriment of the employees, but to make sure that we can continue to provide a good health insurance plan for our employees.
And Jason, I'm fully supportive of that. I get that, and I just want to make sure that, and I'm glad to hear that it's going to be pharmacists reviewing this and not a insurance adjuster. And you know, I know that you'll be representing Indian River County, but I'd also like you to represent the Indian River County employees that this is impacting, and just make sure.
And
I'm all for getting rid of the things where we're getting hosed on.
I understand your concerns and hear those, and that's what our goal is, not to try and restrict access to care for our employees. It's only to reduce these things where there are abuses to us financially, honestly, at the end of the day. But I clearly understand your concern there.
This is much like the acupuncture issue that we had before, where there's some bad actors which are driving prices up tremendously to the detriment of everybody in the organization. And I think that the staff worked out a very good solution there, and I believe they can work out a good one here. Commissioner Fletcher.
Thank you, Mr. Chairman, and for Doc. I'm very supportive of eliminating the bad actors and abuse to a system. Most certainly, the example you cite with ibuprofen is clear and evident that, yes, over the counter, and as a pharmacist, you could determine that medication could be sought over the counter. But when Suzanne mentioned it earlier, I got some concern about a certain medication that is prescribed and has an additional benefit if a practicing physician is prescribing that in the best interest of the patient. I don't know what authority we have, or anyone has, to interfere with that process. And I'm quite concerned about that, because I know as a practicing pharmacist, you may have called the doctor before you dispensed, and I know that many pharmacists do that, but just to make certain that it was written correctly and that we are processing the right pharmaceutical, but to interfere with the application of a substance that a doctor, a chemist, a physician is prescribing for the best interest of a patient, I have the same grave concern.
So I'll just share one example. So there are a lot of acne medications on the market that have a separate benefit for preventing wrinkles. And so a physician can prescribe, say you have a 35-year-old woman getting Retin-A, which should be utilized to treat acne in typically, a teenager. And so programs are put in place to prevent the use of a cosmetic side effect of a drug being used for that cosmetic purpose instead of the actual FDA-approved indication for that drug, which is to treat acne. So that's sort of the example that Suzanne was getting at. It's utilizing like an antidepressant for weight loss, right? We know it's a really, really old antidepressant, and there's a million other ones that work really, really great, but this really old one, has the impact of weight loss, for example. And so we don't want physicians prescribing drugs for cosmetic purposes that you guys are paying for just because, they can get it to go through easily in the system. So those are the types of things that we would be looking for when we're talking about, physicians prescribing for things that maybe wouldn't be something that the county wishes to cover on behalf of their members, such as wrinkle cream. Does that help clarify?
I guess you're identifying that we want to isolate any obvious abuses, as the chairman cited when we had the acupuncture scenario here before us. And I agree, and that was another awkward moment because some people are taken out of pain and some people will be treated properly by a physician, and I did not want to interfere with the Hippocratic Oath that the doctors maintain, and I did not want the perception that we're going to try to eliminate some of the prescriptions that a doctor may prescribe that will help individuals. I understand there is a difference, but there's a line between abuse and authority, or abuse of authority.
Agreed. Yeah.
Thank you.
Just to follow up on that then. So to me, that's where the gray area really is, because so like the acne benefit, I get that. That's kind of more cosmetic. The side effect of weight loss, I would look at, well, wouldn't that make for a healthier employee if they lost excess weight? So to me, that isn't really cosmetic. I mean, losing weight I think is a good thing health-wise, most people would agree with. So that's where I just see the gray area and determining what's cosmetic and what is a health benefit, I guess. So just.
And that's why we would have the pharmacists have the discussion with the physicians. I need to come closer. That's why we'd have the pharmacists have the discussion with the physicians to make further inquiry. As a plan administrator, we're limited in our ability to analyze and review data. We get aggregate information and we do not see the claim detail, we do not see that level. And it's unfortunate, but as Jason stated, the bad actors know this. And if something can get in under the radar and hit the plan and drive up expenses to the tune of $413,000 projected in 1 year for things that may not be medically necessary, that may be 2 blended medications that you can get over the counter, my obligation to the plan is to try to find those things using the tools that we have in place and keep those assets in place to provide coverage to the 3,600 folks for legitimate medical and pharmaceutical needs. So that's why we have that program.
So I have a question. If I'm a pharmaceutical company and I make a drug and I go through the FDA process and it's treating one thing, antidepressant, and then we find out, oh, hey, there's this side effect that's a benefit that maybe could treat another problem like weight loss. Is there not an FDA process that I could go through to get my drug approved for that purpose? And wouldn't it benefit my company because I could sell to more people if it was actually an approved, FDA-approved medication for this other ailment that I'm trying to treat? I mean, wouldn't that be in my own financial interest as a pharmaceutical company rather than having a doctor prescribe something that's something other than what it's approved for?
The short answer is yes, there is an FDA process. It's very expensive for companies to go through that process. And you have to remember that they're sort of in their window of their patent life, right? So sometimes they do that if they think they can extend their patent as a result. Sometimes, like for Humira, for example, this is the top grossing product in the country by far. And now they're coming out with a new formulation that's going to hurt a little bit less to inject, that's going to extend the patent even further and continue to allow them to keep this drug as a brand name. So it's not always a great thing if they continue to add indications, if you will, to a drug for the general population, right? It continues to keep that price really, really high. And for something like weight loss, just specific to that, you know, most health plans don't cover what they consider cosmetic drugs. So weight loss may or may not be added as one that's kind of questionable. But there's a lot of drugs out there specific to treat weight loss, and you know, there's a lot of different strategies you can put in place specific to weight loss. So I don't know off the top of, do you guys cover weight loss drugs? Do you know?
It would depend on on the person's condition, and if it was medically necessary, probably for some other medical conditions, you know, to get the weight down and control other items.
Yeah, so certainly not opposed to better weight management.
We don't cover
To your point.
bariatric surgeries.
Yeah.
Well,
There's a big risk for that.
Yeah.
Another interesting thing I wanted to share with you these types of plans. If our plan was designed where, like for example, I was reviewing a plan from another, Palm Bay, City of Palm Bay. They have a plan that they offer to their members. It's a high deductible health plan, and it's low cost. But under that plan, you have to meet your deductible before the plan pays anything on all lines. Doctor's visits, okay, other than wellness, x-ray, ER, prescriptions, the member is on the hook for that dollar, that first dollar, up to like $2,000 a year, and then the plan pays 80/20. That's a consumer-driven plan, where if I as a member went to the pharmacy to get that prescription filled, right, and I know of someone personally who did that, they're on a high deductible plan, and they went to get the cream filled and was told it was going to be $800 for the cream because they're on the hook for the first out-of-pocket expenses. The plan's not covering anything until they meet their deductible. And then they ask the pharmacist, is there something else that I could use instead of this $800 cream? Yes, there is. So under those types of plans, that consumerism is there because that member is asking the questions about this. Under our plan, it's co-insurance. It's a copay. It's pretty low. So we don't ask. We just go and we get. And we don't realize that on the back end, it's $2,000 charged to the plan when that medication could have been attained another way in a more affordable manner. And that's why these types of programs are in place, is to cause that to happen, because there isn't consumerism under our plan. Does that make sense?
Mm-hmm.
Okay.
Commissioner Zork.
Yes, thank you, Mr. Chairman. I have a couple of questions. One, if we could take one step back to get to the root of why we're going to the two types of plans, is what type of increases were we looking at would kind of said, hey, we need to break this into two levels of options?
It would be close to where we're at on the Premier Gold plan today for everybody.
And so if you applied that as a percentage, was that a 5% across the board, 10% across the board?
Well, it's kind of different because it's an actuarial, you back into it based on projected expenses and a per member per month or per person per month fee, and then you roll it into a single coverage and a family coverage, because we don't pay by person. We've kind of broken it down into two tiers. So you're looking at getting the $22 million through the enrolled members and backing into finding a single premium and a family premium, and the county paying a share and the employee paying a share. So Jason, I don't know if you have.
And I think so what we were looking at was something that's similar to the gold plan that we're talking about, but what we wanted to do with that, knowing that premium increase is significant, is providing a lower cost alternative, so hence the silver plan. And I think if you look on the comparison of the other local governments, you'll see that almost all of them do have 2 or 3 choices. So this is fairly normal. So you're giving your employees, hey, if I want to have that plan that I've had, I want to have that same coverage, I don't want to pay the higher copays or whatever, I'm going to pay the higher premium. You may have other employees who say, that's an awful lot of money for me out of my pocket. I'm going to take the silver plan, and it's, it's on the family plan, it's like about $130, $140 less a month for the silver plan. So, you may have a lot of employees who say, look, when I go for that office visit, it's going to be $35 instead of $25. Well, I'm still ahead because I've paid over $100 less this month for my premium, or if I have to pay $15 more, $20 more for a prescription, I'm still going to be ahead. So we were wanting to provide that choice so that our employees can make that decision, and we need to provide assistance to them, and that would be our plan in making what plan is right for me. So we would need to roll out that support for our employees, and that's our plan, and that's why we want to move this along fairly quickly. And really, at the end of the day, we're trying to provide a benefit for our employees that's competitive, but at the end of the day, these costs are happening, and it's a matter of, some of them, it's a matter of splitting the cost between the employee and the employer. In this case, the employer is a taxpayer. So if you look at the comparison on page 7 of the agenda item there of the backup, I think you'll see that our premiums, so just looking at the family premiums, we're still towards the low end of our competitors. And when I say competitors, I mean other local governments. And the family premiums, now we've looked at Brevard, St. Lucie, Martin County, the municipalities in our county, and the neighboring communities, and the range in all of those, the monthly premium is from $120 to $944. But I will point out that is not a gold level premium. If you're looking at something that's comparable for...
Maybe I should step back and say, if the cost of health insurance increase was 2%, we probably wouldn't be having this conversation.
That's correct.
But I'm just trying to get an idea. So are we looking at a potential 10%, 5%, 15%? If it was 2, we wouldn't be doing this. We would figure out how to work out the 2.
Right.
So
No, it was double digits.
Yeah.
Okay.
Yeah, probably.
That's where I was trying to, and that's why we're needing to look at a way of approaching it.
And I got to tell you, so I work with Lockton, right? And they're like, it's looking like a good month on the claims. Then the next month, oh, you guys got hammered.
Right.
Oh, so that's the reality. You'll have a good month, and then you'll have a month or two, and you get hammered. And then you think maybe, so it's this, so we project out. And I got to tell you, our covered lives, there have been some serious issues that you wouldn't want anybody to have to experience those issues. But the reality is, it's there, and the plan's paying for it. We're hitting, the $22 million mark on projected expenses. Our stop loss insurance, which will be an agenda item that I bring back to you probably in August, September, we're over 20% increased premiums that it's looking at on our stop loss insurance. So we don't have the finals yet, but the numbers are going up substantially.
Okay, then I've got a couple more here to not use up everybody else's time. When we did the pharmacy change, it was about a year and a half or so ago.
May.
When on there's a rebate component
Yes.
in that, and who gets the rebate? The county does. Okay.
100%. That
100%
was one of the
to
reasons
the
why
county.
we made that change.
That's what I had thought.
And there's better transparency in that.
Completely
It was
better.
a black box before. They just send us checks, and we don't know what
Right.
we're getting. We know what we're getting.
I want to see the delay.
Next, in looking at, I pulled up a couple of comparisons, but I don't have all the information. So when we look at comparing our plan to somebody else's plan, I don't know what their plan covers to know is one a good deal or a bad deal. And also the second part of that question, some people break out, where we have now 2 categories, individual or family.
Yes.
And others have employee, employee spouse, employee children, and family. They break it out 4 ways, which may be too much. I don't know where the appropriate place is, so you don't have somebody that is having to provide health insurance for his kids, but he doesn't have the need for a family. So if you go from single to anything, you pay a pretty big step up. I don't know if it's appropriate to have a third option in there, or how does it work out better?
So the way that we've got it structured, single and family, and what the county is paying for single and family, makes it to where single and family are affordable. When you break into a 4-tier and you start looking on that comparative spreadsheet where people are paying $600 a month, $700 a month, $800 a month, $900 a month for family coverage, those are the ones that are broken out into 4 tiers. And family coverage then goes up because you're not getting your premiums dollars in on your single group. So basically the county pays a high single coverage cost to ensure to kind of keep the family coverage low cost. Does that make sense?
It does kind of, and I don't know what the strategy is, and I think you explained that when you go with the 4-tier option.
It prices family coverage up really high.
Right. And some people may say, well, they have a family, they have more exposure, they should pay more than a husband and
You
wife
can make that,
combination.
yes, you
Right.
could.
So going back to one of my earlier questions, so when we compare to another premium cost from another jurisdiction, so I'm going to just pick somebody, St.
I have
Lucie.
most of them here, so.
Oh, okay, so that's something, that would be helpful to have to review between now and then. If their deductible is $5,000 and ours is $2,000 or whatever the number is, and I can then equate that to the difference in the premium cost, it may make more sense.
Sort of.
Right.
I got to tell you, you've heard apples to apples, oranges
Right.
to oranges. We've got apples, we've got pineapples, we've got bananas, we have grapes, we have cantaloupe. I mean, it's the differences between the plans and the design is very diverse. You will look at it and your head will be like, well, I don't even understand the difference. At the end of the day, it probably is a better way to look at actuarial value, which I don't have access to their actuarial values of their plan, but I would be happy to share that information with you.
Okay, whatever you have would be helpful. Reed.
Absolutely.
And last thing I'd probably like to say, and I think that we have always done a great job of providing health care options to our employees at probably one of the lowest cost operators along the Treasure Coast. We've always done a great job with that.
Right.
We've had some hiccups where people have some bad actors, like on acupuncture, those were $1 million hits. And if we have bad actors in other arenas, we want to take care of the employee for the health item that they need and not have somebody exploit that for another benefit somewhere else. We want to take care of them, whether they're sick or injured on the job or whatever it happens to be. We want to take care of them. We just need to do it in a financially responsible manner.
Exactly. The other thing I'd like you to consider as you look at the plans, each individual employer stands alone for their experience. Their experience is going to be unique to them. Some years will be good.
Right.
Some years will be bad. And so you might see one employer, I'll give you an example, Melbourne. Melbourne has an HMO plan. It's a closed physician network. You have to work within that Health First network. Their single coverage is $0 cost, and their family coverage is like $228, I think. But they don't insure their retirees to have coverage outside of the area under that plan. The other plan that you look at, the POS plan, that's the one that's similar to ours that provides that broad network nationwide coverage. So for us, our plan under both plans have that expanded nationwide network, the blues, and there's a cost to that.
And the family premium for their high plan is $806 a month.
Yes, for the members portion for family coverage. And they have a 2-tier, employee and family.
Thank you. And I'll
welcome.
look forward to getting with you to
Sure.
get those others.
Any other questions from the commissioners? If I can
Thank
get a
you,
show of hands, who from the public is going to want to speak or ask some questions on this item? Just the one?
And the sheriff.
And the sheriff, okay.
And one more in the back.
Hey, you sitting
If you're short, we won't take a break, but if you get too long, we're not. So with that, I'll ask if there's anybody from the public who'd like to speak on this.
Thank you, Commissioners. One thing, just keep in mind, obviously when we prepared our budget, Sheriff's Office budget, which was due on 5/1, we had one set of dollars for health, which went up $100 per person, employer cost, and now last week I find out it's going up another $100 proposed. So I think on the broad level, we need to keep mindful for our workshop about where those dollars are coming from. Several $100,000 affecting the Sheriff's Office from today's rates, so I have to be mindful of that. Second, I think all of us have open enrollment coming up in the next few weeks, so that is something to be mindful as well, as there may be other options. And finally, if you look at the Family Gold Plan, I think as Mr. Brown indicated, the premium being $400 versus what it is today. So if we take an average county employee, which our base salary is $25,000, and we have a large amount of employees between $35,000 and $45,000. If you go with the Gold Family Plan, that's $1,591 in premiums per employee per year. If you do the simple math and think that we were favorable enough to give them a 4 or 5% pay raise this year, 5% of $30,000, of course, is $1,500. So essentially, the increase in the premiums is going to wash any salary increase that they may get in October. Just something to think about for our workshop. I think it's a great idea to table this. I think there's other options that we can look at as well. For example, some may argue that the single plan perhaps could be increased employee-wise. That's one option, but there's a lot of things to think about. But the big thing is, I'm looking at $700,000 to $800,000 increase from this time today, what we're paying versus the proposed.
Thank you very much.
Thank you, Sheriff.
Anybody else from the public? Name and address for the record, please.
John O'Connor, International Association of Firefighters, Local 2201, President, 2076 35th Avenue. I echo the comments of the sheriff and the fact that the raise, indeed of any raise of any kind that we're negotiating right now, is going to be a wash as relates to the increase of the healthcare premiums. More importantly, we have a major problem right now with attrition. We're not really competitive in the marketplace in that respect. I was not here when the HR director was commenting on how are we competitive in the marketplace that relates to the actual benefits, but we're really not competitive in the marketplace as it relates to salaries. So we would take one if we had the other, but we really don't. So we're going to be impact bargaining these potential impacts as relates to our membership, and I would encourage staff and the board to make sure that we're more competitive in the marketplace, because quite honestly we're not. We're not able to retain anybody right now. I mean, one of the reasons why I was delayed is we were on a call this morning. We didn't even have enough deputies to cover the calls, because the calls of service keep on going up exponentially, but staffing and other types of issues are not commensurate to what's going on out there on the streets. So appreciate your time. Thank you.
Thank you very much. Anybody else want to speak on this matter? Name for the record, please.
Good morning. My name's Chris Lester. I'm a detective under Sheriff Lohr. I'm kind of new to all this kind of stuff, but what doesn't make sense to me is, we're getting smaller and smaller salary increases, and these costs go higher and higher. For myself, being a 30-year-old male, my wife being 30, and then we have a 9-month-old child. We're all very healthy, thanks to God. So we don't use the health insurance that often. But my family plan is going to go from $240 to $400 a month. Now, we don't use health insurance except for that catastrophic incident, a car accident, someone gets cancer. We don't go to the doctors for a head cold, for minor things like that. So the higher deductibles, the higher monthly insurance, the lower pay raises that we're getting are basically, we're losing money and we're not benefiting from it at all. So if there's any way you guys or the human resources can look at options for healthier individuals or cheaper options that don't raise deductibles considerably. I mean, I'm not very versed in the health insurance world, but there's got to be something for the people who don't use this to have a lower health insurance, if that makes any sense.
It does.
Thank you.
Thank you very much. Anyone else wish to comment on this issue? Name for the record, please.
I'm Bob Sunkel with the New York County Sheriff's Office. I'm a detective as well. I was just looking at some of the numbers. I know we're talking about percentages and how it's going up double digits, but for me, mine's going to go up triple digits. Mine's going to go up over 100% from $50 to $110 for the single male. I know looking at someone who's a family, he's going to go up to $400 a month, which puts him at paying $4,800 a year in health insurance. Then if you factor in the average rent in this county, which is around $1,500, that's $18,000 in rent. And then you go about $100 a month for food for a family, that's another $5,200. So we're looking at just for costs for the year, he's already at $2,800, and that's all looking at our income. If you say our average income is $45,000, which the majority of our deputies are not at that salary, they're now making $17,000 to live on before taxes. And I know on mine, I lose about 19% every pay period in taxes. So then you're leaving the average person around $8,500 a year to live on between everything else. And I know they're comparing the our county's plan to other counties' plans, but it's hard to do that when our agency is the lowest paying agency on the Treasure Coast. So we're comparing ourselves to what they're going to pay in health insurance when really we're making way less.
Thank you very much. I think it's going to be an interesting workshop.
Yeah, and just if I may, so Suzanne, I didn't get his full name of the first detective who spoke, relatively young. He and his wife were apparently relatively healthy, single child that sounded like, he says every time it has the sniffles, they don't run to the doctor. So in my mind, that's where the silver plan would benefit that family, because they don't go to the doctor very often. It would actually lower their family premium on a monthly basis. Now that's offset by, you know, a $10 increase if you go to the walk-in, but you know, your monthly cost is going down every month, and if you only go to the doctor once a year, you know, you're still saving there. So that would be an instance in my mind where the silver would be appropriate for that family situation.
That's exactly right, and that's exactly why we wanted to address providing a more affordable option for people who did not need the gold and did not want to have that money, that extra money coming out of their check. Now, it's important to note that the county's costs are going up. The current contribution that the county makes for single coverage is $635 a month. We're proposing it increase to $735 a month under the silver plan or the gold plan. Right. Okay? And the county currently pays $875 a month for family coverage. We're proposing to increase that by $200 a month to $1,075. So annualize that, single coverage contribution by the employer, $600. $2,400 more that the employer is kicking in annually for either the silver or the gold plan. So we're making a commitment, a strong financial commitment of funding on the employer's side to help keep it down. So we're hoping that by making this commitment on that employer side, we're going to be in a good spot for a couple years and not have to revisit it. But the reality is costs will likely increase. The trend is 8% on medical, much higher on pharmacy. We're trying to be fiscally responsible by making sure that the benefits that the plan pays for make sense and that we keep the premiums down.
And the sheriff mentioned the open enrollment. We do that in August, is that correct?
Well, the sheriff has a different timeline for it, and that's a little bit of my concern. I was speaking with Jason this morning before the meeting on tabling, is because there's a lot of work that has to get done in order to get everything ready for that open enrollment. The BOCC and the other constitutionals, we do ours in August. I think the sheriff might be in July.
Yes, ma'am, end of July.
So,
And I appreciate the timing, but I really think it's important we just give everybody a couple of weeks to soak this in. And then employees can switch between plans every year at open enrollment. So like the detective has one child, they decide to have a second, and then all of a sudden they get triplets or something. They can, at open enrollment, they can move to a different plan and have coverage. So
That's a qualifying event too if they have children.
oh, they could do that.
not to make the plan change.
Oh,
I don't believe.
okay,
It's just to enroll the dependent.
Okay. But
These things are, this is a big deal.
and I
This
think,
is a big deal.
I think the
These
board
benefits are a big deal.
clearly understands all that, and
And we take it personally. I know the discussions that we have, we really do. I reached out because I was interested in finding out how many people under our gold plan reach that out-of-pocket max, right? How many people? So wanted you to know that we had 3 family units that met the family out-of-pocket max, and 199 out of 3,600 who met their individual out-of-pocket max in the year. So our out-of-pocket max currently is $3,000 and $6,000, and then the plan covers covered medical expenses at 100%. Just a little bit more information for you to think of.
And if I could, Commissioners, I just want to say, obviously, the board knows how important this is to our employees and to the county overall, and we're trying to provide options, and those costs just go up. That 8% a year is on a $20 million plan is $1.6 million a year. So that's the nut that we have every year. So we're trying to bend that down with things like the pharmacy program and things like that. But you're looking at a new $1.6 million year after year after year after year. And healthcare is just expensive. It is, I think, about 19% of our total GDP. Well, what does that mean? That means that for every $5 that everyone in this country makes, one of it is for healthcare, period. And it's growing. That 8%, our economy is not growing at 8%. 2 to 3% is what we've been looking at the last few years. And there's actually charts that show if you carry that trend out for about 40 years, they intersect. So obviously, we can't continue on at 8% if our economy is not growing that fast, because eventually, people have to eat and have a place to live. So you can't spend every single dollar you make. But it's just a tough thing. Everybody's dealing with it. I can tell you there's a local government just south of us. I think the employer cost for their family plan is nearly $2,000 a month. So that's like $24,000 a year. When you get to that, you got to start looking at your lower paid employees. Can you afford to have them working for you? You're basically make it to where you have to outsource things because you can't afford. If you've got somebody who's making $14 an hour, you're spending as much on their health insurance as you're paying in salary, and then they're committed, and then they're having to pay premiums. So it's really an affordability issue, and we're so it's not an easy issue. I think the workshop and having a couple weeks to look at it, while it makes things tight for our open enrollment for all of our agencies, I think it's a good thing. I do also want to say what we can do is kind of phase this in, do like a 2-year phase in where we would be looking at half of, something a little over half of that premium increase for the employees. So we can bring that back and we can talk to the employees about that alternative and bring that back as an option for the board as well. I think this is where we're going to need to get to, but we've had a little bit of a reprieve. The agenda item shows that we're expecting a loss of a little under $700,000 in the health plan. When we started looking at this after the first quarter, the projection was a $2.3 million loss. So our first 3 months were terrible. October through December were terrible. It was a 5-alarm fire, if you will. Now it's gone down to maybe a 3-alarm. But April was not so good either. So we're needing to take action so that we don't wait too late, as we've seen the ramifications of that. We try to stay ahead of it. We don't want to get behind it, because when you get behind it, you get behind it so fast. If we were to lose $2 million this year and we don't do something else, then we're losing $4 million, $3.5 to $4 million next year. So it really snowballs on you fast. So that's why we're here trying to address this thing on the front end. Not fun for the employees, not fun for the employer either. And we understand the concerns that the employees have out there. And healthcare is just expensive. And I talked about bad actors before, but healthcare does some great things. There are people that are alive today that wouldn't have been alive 10, 20 years ago, but it's expensive. We have one employee who's got a medication or I don't know if it's one member who's got a medication that's $500,000 or $600,000 a year. And I can't imagine us not covering that. There's no world in which I think we would not cover it, but that's just something that hits our plan. It's just a little bit of bad luck, and this is not something that's under the control of anyone. It's something that you know, when you have 100 lives, you're going to have a certain number of people that have challenging health situations, and some of those health situations are expensive. And I believe we should be providing those services, but it does make it challenging from a financial standpoint. So we're just trying to balance that. So I'll stop talking now.
And
Thank you very much. Commissioners?
one last. Would it be possible to look at a third way to look at it would be where somebody had their own HSA, which that's an available option through payroll, but a plan that would say that the employee's going to pay the first, like that example you used.
The high deductible health.
The high deductible plan, and then those folks will go out and shop and go for the lower cost option that meets their medical needs and that their doctor's okay with, but it puts that competitive shopping for the item because they're paying for it out of their own dollars. Is that something that could be looked at?
Many employers have looked at that. When you look at disruption to your covered members, going to a high deductible health plan is a huge disruption. So people really feel that because they're paying first dollar medical bills. It does bring you consumerism, where people are starting to be more aware, but that's a really tough thing, and you have to look at it actuarially. How many people do we really expect to go there if we still have this over here?
Right. So it would be helpful for ones, but could be less helpful for the plan overall.
Overall,
But
and
is
the
it
people who were there and were experiencing that's a tough, no pun intended, pill to swallow, to have to pay for that first dollar.
But if you're reducing your monthly employee responsibility portion and you can see a direct benefit, some people, that may be
Some people might choose that, yeah. That's true. And we were really hoping with the silver plan being more affordable, saving on the employee premiums,
Right.
but still providing that 80% actuarial value of coverage in the event of a catastrophic incident. We were really hoping that meets that need of affordability for our members.
Right. So for some folks, they actually could stay with what we currently have, go with the silver, and actually have less monthly premium costs
Yes,
going forward.
and just have an 8% actuarial difference on the benefit payout overall.
Right, okay. All right, thank you, Mr. Chairman.
Thank you. Mr. O'Connor?
Yeah, John O'Connor again. Is there a way to change the notification process as far as it relates to something like, I mean, the HR director referred to this as a big deal. I agree it's a big deal. But had we, currently the notification process, you know, I talked to a couple of people this morning, the agenda comes out on a Thursday. I got notified by this on a Friday. You know, today's Tuesday. We represent 240 members. The sheriff's deputies, I think they have close to anywhere between 400 to 600. I'm sure there's quite a few people that would probably be here right now speaking on this issue, and to not, and I appreciate the fact that the board has recommended to have a workshop related to the employees, how they can speak about what's going on, but I think that kind of loses its efficacy as it relates to what's being done right now today.
I think that's a good point, and I think that's something that you might, both you and the sheriff might try to come up with a couple of these type of things that you'd want more notification from, and just let the county administrator know. Now, one of the problems is the information might not be all ready, you know, in advance, because sometimes the staff is working hard to compile the information, but we can at least, I think, to some degree, give some notice of the upcoming event. And then I'm sure that the county administrator would share what information was available at that time. But again, sometimes the information is not ready until it just is compiling the agenda. But I can definitely see the point of getting advance notice on the issue coming up, as far as is practical in the event.
Yeah, I mean, right now, currently, I mean, it's just by luck that I'm not on shift.
And we understand that. I mean, that's the type of thing we.
And that's why I brought up the delay, John, so there would be time to get this information out. And now, all of your members can go and watch this tape, you know, over the next 2 weeks. They can sit at home and call this up and watch the whole tape, see the whole presentation, get all the discussion. And so I'm hoping that's what they do over the next 2 weeks, is do their due diligence, just like anybody else would. And Commissioner Fleischer suggested the workshop for even more information. So I talked to the administrator about this yesterday, that I wanted to have a delay to make sure, because it is a big issue. It affects all the employees, and I want to make sure that we take the time to get the information out. And I think that's what we're doing, is giving them an opportunity to watch the tape, get the information, talk to Suzanne. You'll be, and particularly the folks impacted by the pharmacy thing, I think is very important. But, you know, I think the board is cognizant of the fact this is a big deal, and we want to make sure everybody can weigh in on it.
Appreciate that. Thank you.
Thank you.
I just want to thank you for coming down from North Carolina. Are you going to stay here through the rest of the weekend by any chance, or?
Sure, I'm headed out this afternoon.
Ah, dang it. Trying to boost the tourist tax dollars.
They did stay local, though.
Yeah, good. All right.
Thank you.
Oh, Susan, also, if you could send me the rebate history from when we put that plan into effect going forward, if you could shoot that over, that'd be great.
Okay.
Thank you.
Thank you. And I believe that pretty much covers this issue for today. We look forward to both the workshop and discussing it again in 2 weeks.
Okay, thank you.
Thank you. And that actually covers the agenda for today, but Mr. Yano had one question. I'll let him come up and ask it if he would. Still wants to. And I take it this was on an issue that we discussed today.
Hey, Mark.
Yes, thank you. Maybe I don't understand protocol. I was curious as to why there was no public comment offered on that wonderful presentation that the.
It's because that's not something we're voting on.
Okay.
That was the public comment of the people coming up here.
I got you.
The
I
same
just
as when
didn't
you've
understand.
come up here before, you've made public comment, and if.
Okay.
So there's not, so that's it. And with that, we are adjourned.